Now, according to water experts, the Hammanskraal water crisis should be treated as a national emergency and a violation of human rights. Now, this crisis has been ongoing for nearly 2 decades, with different political administrations failing to avert it. For more on this, we are joined by Water and Sanitation Director General, Dr. Phillips. A very good afternoon to you. Thank you so much for your time. I mean, various water experts have spoken about how government was warned that such a crisis would unfold, and they also said that cholera infection was or is actually preventable, because all it essentially requires is access to safe water, adequate sanitation and basic hygiene needs. Surely that shouldn't be too complex.
Thank you very much, Impo, and good afternoon to our listeners. Yes, the National Department of Water and Sanitation has also been warning for some time that municipal water and sanitation services have been deteriorating. We issued our Green Drop regulatory report last year, which showed that there had been a decline in the state of municipal wastewater treatment works. The wastewater treatment works in Tshwane, which might be the cause of the cholera outbreak in that area, were amongst those that we identified that had been deteriorated. And unfortunately, it is fairly complex. It might seem simple to provide clean water and to deal with sewage effectively, but it is fairly complex. There's a water cycle. Water is taken from our streams, treated in water treatment works. Then the wastewater from the sewage systems has to be treated in wastewater treatment systems before it goes back into the rivers. And in terms of the constitution that we agreed on as a country in the settlement after apartheid in 1990, there's division of responsibility between different spheres of government. Municipalities are responsible for water and sanitation services. So there is quite a complex constitutional arrangement between the national government and municipalities with regard to providing water and sanitation to communities.
So if this outbreak in Hammanskraal is any indication at all of where things stand, it's pretty clear that the current state of drinking water supplied across the country needs critical evaluation. I believe 80% of wastewater treatment systems have been identified to be in a critical state. Can you quantify exactly how bad it is? Because you say it is indeed a complex matter.
It's a big concern. So you're correct. That was our the results of our Green Drop report assessments in 2012. That approximately a third of wastewater treatment plants in the country are in a critical condition. Now, perhaps even more importantly, next week we're going to be releasing the results of our Green Drop report, which similarly assess the condition and functioning of all the water treatment works, not wastewater treatment works, all the water treatment works around the country. And because it's those that are the most important, because it's those that draw the raw water from the rivers and treat the water before providing it to communities. And unfortunately, that report that we're going to release next week is also going to show that there's been a deterioration in that infrastructure as well at municipal level. So there are several things that we are doing to address this. One is that we are making the information public about the assessment so that the public can be informed about these conditions. And when we do the assessments of all these municipal systems, we also identify for the municipalities exactly what is wrong with their infrastructure and what they need to do to fix it. So in that sense, we're also providing support to municipalities in terms of advising them what they need to do. Then the national government also provides a lot of money every year to municipalities in the form of grants to help them to address these infrastructural issues. But the key challenge is that in many municipalities, although they are charging residents for water, they're often not billing and doing revenue collection well, and they're sometimes allocating those revenues to other functions rather than to the maintenance and operation of the water and wastewater treatment works. And the key problem at municipal level is in the maintenance and operation of the water and wastewater treatment works. And that is the key area that needs to be addressed. And in that regard, we're looking at the possibility of introducing some legislative amendments to empower us more as the national regulators, as the national department, but also to assist municipalities which are appointed as water services authorities, to assist them to ensure that their water service providers are well governed and professionally managed, and that they improve their revenue collection, and that they allocate sufficient funds to the proper operation and maintenance of these facilities.
Yeah, you speak about wanting to introduce legislative measures. Surely, this could have been done years sooner. I mean, as you and I were speaking just now, you spoke about how you also, as a department, saw it coming.
Yes, well, that could be so important, and people could say we should have done things a lot quicker, but we are a relatively young democracy. We got our constitution in 1990. We've only had democratic local government in the country since the late 1990s. We're now learning about what works and what doesn't work. And we've been trying through other measures to improve municipal performance through water and sanitation services. As I said, by giving them grants. We've also been taking action as the national regulator in the form of non-compliance notices to the municipalities and directives to the municipalities. We've even, in some cases, been taking criminal action against some municipalities which haven't been addressing pollution issues from their wastewater treatment works. But it's now becoming clear that more needs to be done so that we can arrest the decline and turn it around and move towards well-functioning municipal water and sanitation service providers.
As you and I speak, yet another death has been recorded in Hammanskraal as a result of the cholera outbreak. And within all of this happening, government is seemingly still in the dark about the source of this deadly cholera outbreak. Do we blame the dysfunction of municipalities and water waste treatment works, or is there much more to this?
This is not the first cholera outbreak in South Africa, nor internationally, in which it's been difficult to locate the source of the cholera outbreak. It's in the nature of the cholera bacterium. It can be difficult to locate the source because cholera can be spread from person to person by various means. It can be spread through water and ingesting water that's polluted or infected with the bacterium. It can also be spread by ingesting food, and food can become contaminated from people not washing their hands properly when they are preparing food and then passing through food from person to person. We do have technical task teams between ourselves and the Tshwane municipality and the National and Provincial Departments of Health. We have been doing lots of tests of the water supply throughout the Tshwane area, and the National Health Department and Provincial Health Department have been doing tracking and tracing mechanisms to try and to study what's been happening in the lives of the people who've been infected and where and at what stage they might have been infected to try and trace back to the original source. So it can be very difficult to find the source, but the fact that the number of new infections is now coming down is an indication that there isn't a continuous infection of people through a contaminated water supply. It seems to be more likely that there was a once-off or a couple of infections and they've spread through other means after that. So we haven't identified any particular water sources in the Tshwane area which have now a cholera bacteria in them. But it is possible that the cholera bacterium that the cholera outbreak in Tshwane was a result of the fact that there are malfunctioning wastewater treatment works in that area in Hammanskraal, and there is pollution of the water resources in that area from those wastewater treatment works. And often cholera outbreaks do occur when such conditions exist. So the key issue is not so much to particularly identify the source. The key issue is for us to address that pollution by the wastewater treatment works, to fix it, so that the conditions under which a cholera outbreak can occur are dealt with. And in that regard, we had a media briefing last week. I heard in your earlier statement that this issue needs to become an issue of national urgency.
Yes.
It has become an issue of national urgency. We are partnering with the city of Tshwane. The national government is committed to putting in place a financial plan to enable the Rooiwal wastewater treatment works to be properly fixed. And we gave more detail in the media statement with regard to the timeframes of when that's going to be done. So that work is now starting, and we're going to make sure that that issue is now addressed once and for all.
An NGO called Water Can, it's part of OUTA, they conducted tests which showed that no cholera in Hammanskraal, but found that the water from 3 or 4 of the taps tested in Hammanskraal was unsafe to drink. So it really points to a major cause for concern, as it indicates either inadequate treatment before it goes into the pipes, or that water is secondarily polluted after it leaves the treatment facility. Either way, the bottom line is that it remains unsafe to drink. What is the way forward looking at that scenario that I've painted?
Yes, you're correct. And in fact, the Tshwane municipality has been doing exactly the same tests, similar tests to Water Can, and they've been producing exactly the same results. And they have been warning all the people in the Hammanskraal area not to drink the water from the taps, and rather to disinfect or boil it first. But they didn't want to switch off the water from the taps altogether, because that would deprive people from using the water for other purposes, such as washing clothes. So they've been distributing clean water, which has been tested regularly, and it does meet the drinking water standards to the people in Hammanskraal, so that they can get drinking water. Now, the reason why the drinking water is not fit for human consumption is, again, because of this malfunctioning wastewater treatment works at Rooiwal. That wastewater treatment works doesn't have sufficient capacity. It's not large enough to deal with the sewage flows coming into it, and it hasn't been maintained well for a long time. It needs to be upgraded, and it needs to be repaired. In the meantime, what it's doing is that the way a wastewater treatment plant works is that sewage, when you flush your toilets, the wastewater goes into the sewage system. It then goes through a series of pipes and sewage and pumps to the wastewater treatment works. And the wastewater treatment works' job is to treat that sewage so that it meets standards, so that it can then be put back into the river and it can flow downstream. The problem is that wastewater treatment works is not treating the sewage to the right standards, because it's dysfunctional. And the effluent that is putting into the Arpies River is below standard, and that in turn is going into the Newzroom Dam, from which the Temba water treatment works of Tshwane is drawing the water to treat it before distributing it. And because that water is so polluted, it's not able to treat the water sufficiently to drinking water standards. And that's why they've advised their residents not to drink that water until such time that the tests start showing that it meets drinking water standards. And that's why it's imperative for us to work with Tshwane to fix that wastewater treatment works, because it's only then that the water that's being treated by the Temba water treatment works will meet drinking water quality standards.
Just this week, we heard Auditor General Zakani Maluleke saying that the outbreak was perhaps a harsh reminder of the impact of continued neglect at local government level, and that a material irregularity had been issued regarding the Rooiwal wastewater treatment plant. I mean, earlier you were speaking about a division of responsibilities. That in itself also points to a plan that must be formulated for an integration of all the information and all the channels that essentially lead to people opening the taps and having clean drinking water that is safe to consume.
Yes, you're correct. And there is usually a correlation between the audit results in a municipality and the quality of the services delivered by the municipality. If a municipality is well run, well governed, and well managed, then it normally gets audit reports, and normally then it's the quality of the services that it delivers is normally also good. But we need a discussion in society about how to make local government work better. Remember, we have a constitution in terms of which local government is a separate sphere of government. We have local government elections. Local governments, municipalities are run by our political representatives that we elect, and it's their responsibility to ensure that their municipalities are well governed and well managed. But having said that, there are measures that can be taken by national government in terms of our constitution to ensure that municipalities, while being a separate sphere of government, do also operate in a way which meets minimum norms and standards. To date, in that regard, what we've been doing as the National Department is issuing non-compliance notices and directives and sometimes taking legal action against municipalities which don't meet the minimum norms and standards for water and sanitation. But clearly, as we can see now with the continued deterioration in many parts of the country, that's not enough. And that's why I said we're now looking at legal amendments for us to be able to intervene more effectively to ensure that municipalities do have water service providers which are well governed, well managed, and which do provide services which meet minimum norms and standards.
Very well. Thank you for your time. Let's perhaps leave it there for now. Water and Sanitation Director General, Dr. Phillips.